Do you have pain in the back of your knee that won't go away? Let's break down what's causing it and how to fix it without surgery. Hello, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Pain behind the knee is a common issue I see in my clinic, and it's often confusing for patients. Some people think it's a pulled muscle. Others worry that it's something more serious, like a blood clot or nerve problem. And the truth is, the back of the knee is a very busy area. You've got nerves, blood vessels, tendons, and a fluid pouch, all in one small space. So when something goes wrong, it can cause pain, swelling, or even strange nerve symptoms. In this video, we'll talk about the 6 most common causes of pain behind the knee, how we evaluate what's really going on, the best non-surgical treatment options to help you feel better, safely, and effectively. There are 6 key causes of pain in the back of the knee. Let's go through them one by one. The first is the Baker's cyst. This is a fluid-filled bump or cyst that forms in the back of your knee. It often shows up when your knee joint is irritated, maybe from arthritis, inflammation, or meniscus tear. The fluid gets pushed out and collects in the back like water in a balloon. You may feel tightness, swelling, or a sense of fullness behind the knee, especially when you bend it. Number 2 is hamstring or calf tendon problems. The back of your knee is where your hamstring and calf muscles attach. If you've been doing a lot of running, squatting, or sports, these tendons can get strained or inflamed. The pain is usually sore or tight, and it gets worse with movement. This is one of the more common causes in active people. Number 3 is arthritis in the knee joint. Arthritis does not just cause pain inside the joint, it can lead to swelling that pushes fluid to the back of the knee. This can cause pain or even create or worsen a Baker's cyst. If you have morning stiffness, clicking, or deep aching pain, arthritis could be the reason. Number 4 is nerve-related pain. The tibial nerve and peroneal nerve run through the back of the knee. If they get compressed or irritated, you may feel sharp, burning pain, tingling, or numbness, or pain that travels down the calf or foot. This can happen if a Baker's cyst presents and compresses the nerve, or even from a pinched nerve in your lower back. Nerve pain often feels different than muscle or joint pain. It's more electric-like, more zappy feeling, and can cause weakness too. Number 5 are blood vessel problems, such as the popliteal artery or a DVT. The popliteal artery runs right behind the knee. In rare cases, it can get narrowed or blocked, especially in athletes or older adults. A deep vein thrombosis or DVT is a blood clot, and it's a medical emergency. If you feel sudden pain, swelling, warmth, or redness in the back of your knee or calf, get help immediately to get evaluated for a blood clot. And number 6 is referred pain from the spine. Sometimes back problems don't show up in the back at all. A herniated disc in your lower spine can press on a nerve root and cause pain in the back of your knee. In addition, an SI joint issue in the back of the hip or lower back can also get irritated and cause pain down the leg as well. This is called referred pain, and it can feel exactly like a knee problem, even if your knee joint is perfectly fine. So how do we figure out which of these problems is causing your pain? Step 1 is listening to your story. We start with your symptoms. If your pain is it sharp or is it dull? Does it come and go, or is it always there? Any numbness, tingling, or swelling? Did it start after an injury, or is it gradual? Your answers will guide our next steps. Step number 2 is a physical examination. We check how you move, where it hurts, and whether there's swelling, tightness, or nerve sensitivity. We'll test your strength, reflexes, and sensation to see if a nerve is involved as well. Step 3 is imaging. In the clinic, my preference is to use diagnostic musculoskeletal ultrasound to check for any tendon, joint, fluid-filled cyst, and the nerves in real time. If needed, we'll get an MRI to look deeper at the knee joint or at the spine as well. If there's a suspicion based on your symptoms or exam that you have a blood clot. We will, however, send you for an emergency Doppler ultrasound to evaluate for any obstruction in the blood vessels. Let's clear up a few myths associated with pain in the back of the knee. Myth number 1, you probably tore something. Most back of the knee pain is not from a torn ligament. It's often a tendon issue, cyst, or nerve problem. If there's suspicion that you may have torn a ligament based on your examination findings, then we would go ahead and get an MRI of the knee as well. Myth number 2 is that rest is the only answer. Rest will help short term, but without treating the actual cause of your pain, the pain often returns. Movement, when done properly, is key to recovery. And myth number 3 is that you'll need surgery for this pain. The truth is that most people get better without surgery, especially with the appropriate rehab and regenerative medicine treatments. Let's now talk how we can treat this with safe and smart ways and without surgery. Step number 1 is conservative treatments. Physical therapy and home exercises to strengthen the muscles and improve stability. An anti-inflammatory diet. Less sugar, less red meat, more vegetables, more omega-3s and turmeric supplements. Weight loss if needed. Every pound of body weight adds 4 pounds of pressure to your knees. Mobility and nerve glide exercises if nerve irritation is involved. These are our conservative first-line options. When conservative care is not enough, we offer regenerative injection treatments. Prolotherapy is a regenerative medicine treatment where we inject a natural dextrose or sugar solution that helps to strengthen loose or irritated ligaments. It's great for ligament and tendon pathology that is causing instability behind the knee. Next is platelet-rich plasma, or PRP. This uses your own blood spun down to concentrated healing platelets. We inject this into painful areas like the cyst, tendon, or joint to reduce inflammation and promote healing. It's also helpful for nerve irritation, one applied around nerves or in the spine. And then next you have bone marrow stem cell therapy, used for more advanced cases like more advanced arthritis. This can help to stimulate tissue repair and calm long-term inflammation. Treatments we'd recommend avoiding, to begin with, steroid shots. They can weaken tissue over time. There may be an indication if there's dramatic amount of inflammation in the joint, but it should not be your typical and reliant treatment option. Next are radiofrequency ablation. This is where they'll actually burn the nerve. It can reduce pain, but it can also damage the nerves, and it doesn't really fix the root cause of what's problematic. And then, of course, there's unnecessary surgeries, especially if you've got a cyst or partial meniscus tear, which often don't need cutting out, but can be treated, again, with just good exercise and regenerative medicine treatment options. So when should you look to get help? If you've had pain behind the knee for more than a few weeks, or it's getting worse, it's time to get checked out. And if you're feeling numbness, tingling, or if there are any signs of a blood clot, don't wait, see a doctor as soon as possible. In terms of the blood clot, you really should get seen immediately because that could be a potential emergency. You deserve real answers and personalized treatment. To recap, pain behind the knee has several possible causes: tendon strains, cysts, arthritis, nerve issues, or even spine issues or blood vessel issues. The key is a proper evaluation to find out what's really causing your pain, and most importantly, there are safe, effective, and reliable treatments that do not require surgery. If you found this helpful, please make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. You can also visit us on our social media channels. Thank you for your time today. See you soon, and live well.